Alzheimer's is predicted to double by 2030 and triple by 2050.
People who suffer from Alzheimer's, they will have postural instability. A full-time caregiver will be needed.
Possibly the younger generation keep their mind healthy.
There have been many studies which show that if you constantly use the mind to play various puzzles, people who are very active even in their late age, they have a lesser chance of developing Alzheimer's. The main problem with Alzheimer's is that once it's advanced, around 75% of the brain is already filled with plaques, and then no treatment works.
No Alzheimer's, no dementia is the theme for 2024. And to know more on Alzheimer's, we have with us Dr. Sujith Kumar, Head of Neurology from Apollo Hospitals.
Thank you, ma'am, for the kind words of introduction. Today we will discuss about a few important aspects of Alzheimer's disease.
So when a patient is diagnosed with Alzheimer's, how do they accept the diagnosis, and how do the patient relatives deal with either the mood swings or the cognitive decline of the patient?
This is a very important aspect of Alzheimer's, dealing with the person who suffers from a diagnosis of Alzheimer's. Most often it does not make that much of a difference to the patient because they already will have sufficient cognitive decline, but it makes a difference to the family. So, they had to come to terms with the fact that the person who was once this cognitively well person, slowly his cognition degenerates and then he is not able to cope with even simple acts of daily living. So that is something which requires a bit of counseling, and also one must encourage the caregivers to seek as much help as they can. For instance, taking care of a patient who requires help with activities of daily living by hiring a nurse or another caregiver, so that the emotional brunt of that taking care does not fall on the partner or the wife or the son or something like that. So this is a very important aspect, and one must be extremely sensitive while dealing with the caregivers, and one must explain this very gently, how things will relentlessly progress despite treatment.
So it's also an important aspect for this subset of people to take care to prevent falls, etc. They should have the necessary care. No?
Absolutely. Many of the Alzheimer's people who suffer from Alzheimer's also will develop extrapyramidal features over a period of time, and so they will have postural instability and they have a high risk of fall, which is why a full-time caregiver will be needed to take care of these people who have a diagnosis of Alzheimer's.
So coming to the treatment aspects, ranging from mild to severe symptoms, what are the treatment options available, knowing that Alzheimer's is a progressive condition?
Alzheimer's is a very progressive condition, but before we reach treatment, I would like to just make a mention of how we can diagnose Alzheimer's early. Now, we do have some tools which help in early diagnosis of Alzheimer's. So people who have genetic variants who have the genetic susceptibility, if diagnosed early, one can pick up Alzheimer's at an early stage, or even people who suffer from Alzheimer's, when they have mild clinical features, they can receive some newer treatments. So two path-breaking modalities of diagnosis are: one is CSF analysis of beta amyloid and tau protein, which can be done. Another one is positron emission tomography of amyloid. These are two path-breaking newer methods of diagnosing Alzheimer's, and based on the distribution and all, early Alzheimer's can be diagnosed. Now there are medicines available for early Alzheimer's. Also, it's very important that many of them will have prominent behavioral changes, may have aggression, disinhibition and all, requiring psychiatric medicines, and this must be balanced against their extrapyramidal features. And also ultimately they may require a lot of nursing care, and to prevent falls, and various other aspects of supportive care are also required in the treatment of Alzheimer's.
So how important is it, sir, if somebody has a family history of Alzheimer's, or for the possibly the younger generation, is there anything that they can do to sort of keep their mind healthy to maybe prevent Alzheimer's?
I don't know if you have a genetic susceptibility, it's possible to prevent, but there have been many studies which show that if you constantly use the mind to play various puzzles and people who are very active even in their late age, they have a lesser chance of developing Alzheimer's. People who have a genetic susceptibility should get screened for early onset Alzheimer's. The main problem with Alzheimer's is that once it's advanced, around 75% of the brain is already filled with plaques, and then no treatment works. So the antibodies can work in mild Alzheimer's at an early stage where the diagnosis is made, so that it can prevent further progression. So an early diagnosis is very important.
So just out of curiosity, do you think digitalization and excessive screen time and lack of physical activity and lack of sleep can predispose to early onset Alzheimer's?
So there have been many epidemiological factors which have been studied. They are not linked as a causative association, but they have been associated people who do not, like for instance, people post-retirement who are not very active mentally, people who also have very poor physical activity. These are people who are, and also Alzheimer's is also linked with excessive, substance abuse, various things. So these are some associations, but they have not been causally linked. So in conclusion, it's very important to spread this message that early diagnosis of Alzheimer's disease, there are treatments available, and one must stress also about the various aspects of coping with Alzheimer's even in moderate and advanced disease, so that people and caregivers, more importantly, find ways and means of dealing with it without getting depressed themselves.
Thank you so much, sir. I think we've been enlightened on Alzheimer's. So it is equally important knowing that Alzheimer's is predicted to double by 2030 and triple by 2050, that everyone is equally aware, or the general public is aware on what Alzheimer's is and what to look out for. Thank you so much.
Thank you.